Hi, guys. Welcome to the Trial Site News podcast. I'm Dr. Erin, your host. And today we're going to be talking about bioethics and the COVID-19 vaccine. A lot of times we hear it's our duty, it's our moral obligation to take the vaccine, but is that really the case? And to offer his perspective, today we have with us Dr. Travis Rieder. Thank you, Travis, for joining. So I thought maybe we could start out by you telling us more about who you are.
Yeah, absolutely. Thanks for having me, Erin. So I'm a faculty member at the Johns Hopkins Berman Institute of Bioethics. That's my primary affiliation. I direct a Master's in Bioethics degree program there. And then I have secondary appointments in the departments of philosophy and health policy management and Center for Public Health Advocacy, because Johns Hopkins loves cross appointments. So that kind of gives you a sense of who I am. I'm a philosopher by disciplinary background, but I really work in bioethics, health policy, and the Center for Public Health Advocacy is really there because I have a real passion for communicating important bioethics and health policy issues to the public. So it's a bit of who I am.
So a moral philosopher. I think you're the first one on the Trial Site News podcast. So I'm excited to hear your perspective on some of these issues. So I guess my first question would be, and elaborate as much as you want, are people correct when they say that getting the vaccine is a duty or a moral obligation?
Such a good question. It's such a hard question. As you know, I've written a little bit on this. And so I think the most important thing to say at the beginning is that I'm super pro-vaccine. I have an affiliation with the School of Public Health. Yay vaccines, yay science. I got to go out and see the world a little bit thanks to a vaccine. But this question is really specific, right? It is whether you have an obligation, whether you have a duty. And so as a moral philosopher, one of the things that I really try to remember is that we people use the language of duty and obligation. Sometimes put it negatively, sometimes as a bludgeon, but to put it a little more positively, as a really strong tool in our kind of toolbox of social norms and mores, right? And so what the philosopher will say is, the reason is because obligation and duty implies moral requirement, right? This is not morally good, it's not morally optional, but praiseworthy. It is required. And so here's one thing that I want to add to it. Typically, when we think that something is morally required, we think that other people in the moral community have the standing to demand that you do it, right? So all that is to lay out what I take to be the stakes. And the stakes are that if you are required, if you are obligated or have a duty to get vaccinated, then you are morally required to do it. It's not merely good. And that means that other people probably have the standing to demand that you do it, right? And I think there are good reasons to think that it falls short of that. What I'm going to make sure I say at the end is that there is overwhelming reason to get the vaccine. It's an incredibly good thing to do. And just because there's no obligation to do it, if that's right, doesn't mean that all of us are permitted to go out and like spray our virus all over everybody, right? So if you don't get a vaccine, you're obligated to do other things to protect other people, like distance and mask, et cetera. But I think it's probably the case that you don't have a strict moral obligation because people don't have the standing to demand that you get a medical procedure, which is what a vaccination is. So that I'll end there for like the summary version and let you steer the conversation.
Great. I'm glad you picked up on that. I had follow-up questions, but I really appreciated that explanation. And the one piece that you wrote in there, refusing to be vaccinated does not violate Mill's harm principle. Can you elaborate on what that means?
Yeah, so John Stuart Mill, famous philosopher, modern era, is quite well known for articulating what's called the harm principle. And the reason it's so well known is because it provides a justification on all political philosophy grounds, even on like strict libertarian grounds, for restricting someone's freedom. So the basic idea is you are entitled, the society is entitled to restrict the freedom of somebody if they're exercising that freedom would harm somebody else. So that's a kind of general summary of the harm principle. One way to think about this is my right to swing my arm, which I have the right to do, right? Big open room. My right to swing my arm stops at the contours of someone else's face, right? So if exercising my right would impinge on them, would harm them, now the society is justified in restricting my rights. So what I suggest in that piece is we are very anxious, as public health minded folks are very anxious to tell everyone to get a vaccine. And so we very often say things like, oh, you're just going to kill somebody, like this is supposed to be the justification. But not getting a vaccine isn't a very good candidate for an action that has a really high probability of causing the sort of harm that we find unacceptable. Now, not getting a vaccine, being super careless, exposing yourself to lots of virus, then going unmasked and not distancing, now we start to get to a place where you're likely to cause other people harm, especially with the Delta variant around. I wrote my piece before things got quite so bad. But the idea is that with other mitigation strategies, the protection of the vaccine is this kind of small incremental bump. And that's a good thing to do, but we tend to allow people to go out in society when they pose risk to other people, like with driving or, during cold and flu season, when they've got a tickle in their throat. Like we expose people to some risk of harm on a really regular basis as part of the way we live. And so what's not clear is that you not getting vaccinated, but doing other things actually exposes individual others to an unacceptable level of risk. Now, I'm going to stop so you can steer conversation, but the caveat here is there's still a good population argument. And so most people tend to say then, well, okay, so you might not harm another person individually, but we need to lower the reproductive number of the virus, right? We need to drive the R naught down. We need to slow the spread of the disease. And that's the reason that you should get vaccinated. But that's not appealing to the harm principle. The harm principle is causing direct, kind of noticeable harm to a particular identifiable other.
So maybe some of the, on social media, you sort of see like there's people are very hostile towards each other about this topic. Like there's sort of almost this war really between those who chose not to get vaccinated and those who became vaccinated, and the vaccinated are telling the unvaccinated, you're killing people. And but I think that's just human emotions at play, really. But I appreciated the driving analogy that you just said. Another thing you wrote in that article I thought was really interesting is getting vaccinated intimate. While it may not appear so at first, it involves having a substance injected into your body, which is a form of bodily intimacy. Can you explain how that relates to demanding or saying it is a moral obligation to receive this vaccine?
Yeah, so this is really the crux of the argument for me. So the reason I want to have this conversation is not to be a contrarian with my progressive public health colleagues. The reason I want to have this conversation is because I don't think that everybody that's concerned with getting the vaccine is bad. Right? I think that there are lots of legitimate reasons to be concerned when science produces this product, and then you are asked to have it injected into your body. A lot of people don't fully understand the process. They don't understand the FDA approval process. They don't understand what's happening. They don't know what an mRNA vaccine is versus an attenuated virus, right? So there's all of this going on. You're like, you want to put that in my body. And part of what I want to respect is that that's a super reasonable thing to ask and to say. So here's the background. The background is if you as an individual have just unilateral authority over anything, moral authority, it's who gets access to your body. So that's my moral prior here. I think it's really uncontentious. This is the reason that doctors can't do something to you. They can't operate on you. They can't perform a procedure. They can't even evaluate you outside of emergencies without your explicit informed consent, because you have unilateral authority to tell them to get their hands off of you. If doctors perform an operation on you without your consent, it's assault. This is not just a moral claim, it's also a legal claim. This is ensconced in American law, right? So we take really seriously this idea that to access my body, you need explicit permission. And I'm allowed to say no for almost any reason because it's my body and I have unilateral moral authority. So this is the reason that I think vaccine is so different from mask mandates or from social distancing requirements, because what we're asking people to do is to allow a needle to puncture their skin and this product to be injected into their skin. I think they have overwhelming reason to do it because it's a safe, effective product. But if they're worried about access to their body, I think they get to say no for almost any reason. And so the analogs that I want people to think about are, this is the same grounds, it's a very different case, so no one quote me out of context, but this is the same grounds for why I think women are not obligated to gestate, which is why abortion is impermissible, right? Because people have unilateral authority over their own bodies. They get to decide this sort of thing. It's also the reason that consent is required for sex, and consent can always be withdrawn before or during sex, because accessing someone's body is something they have complete moral authority over. And so if someone just decides, I'm not in the mood, I'm sorry, I promised you would do this, that's okay. They're allowed to do that. So the background here is you have total permission to refuse access to your body. And so go back to the beginning of our conversation. I don't think the moral community has the standing to demand that scientists and doctors access your body. That's the basic point.
And is that for any vaccine? It sounds like it's for anything. And I think, as you pointed out, people do have concerns over this vaccine, particularly, how it was developed. It's new. And a lot of them, besides Pfizer that just got FDA approval, they're still under this emergency use approval, which is sort of an experimental category. But it's all the same in terms of saying yes or no, having a choice.
I think by and large that's true. So now let's get a little bit further into the weeds. I'm not what philosophers call a universalist. I'm not a universalist about almost anything. And so what I won't say is that there's never a case where the moral community has the standing to demand that science or doctors access your body. So make a silly cartoon version. If you're injecting me with some safe and effective substance would prevent other people's particular known predictable deaths, right? Like just my injection, not anybody else's. Then I think this intimacy concern can probably be outweighed at a certain point. And no, I can't give you an answer at what point, right? But there is a point at which you can probably outweigh this concern if it's a very minor violation, right? So just a shot, and it produces a huge amount of good. This can probably generate an obligation, but that's not the way most of our preventive medicine works, right? So that's the case with the COVID-19 vaccine. It's the case with a lot of our vaccines. So that's the kind of tricky area.
And some people also may choose to, social distance or wear a mask and take that route versus get the vaccine. And we see that with the flu vaccine. They choose to wear a mask. There's always an option there. So given all you said, what is your opinion on vaccine mandates? Like an employer someone saying, and we see this happening in the news a lot, even with healthcare workers, hey, if you don't get that vaccine, you're going to lose your job. You're going to lose your livelihood.
Yeah, so I love that you asked this question and that this is where the conversation should go, because my view on this fairly technical point, which is that you don't have an obligation, even if it's a good or a thing that you ought to do, you're not required. That doesn't actually mean that we can't justify mask mandates. And so here's a point. I think mask mandate is a really bad term for what we are typically considering, because mask mandate makes people think of forced, vaccine mandates is what we're talking about. Sorry. So vaccine mandates, this is a really bad use of the term, right? Because it makes people think of something like forced vaccination, but that's not what anybody's talking about. What people are talking about is vaccination as a requirement to access some particular good, right? And so that's a conditional. If you want to access some good, you have to get vaccinated. And I think that can be permitted even if there's no moral requirement that you get vaccinated. So I teach for Johns Hopkins, and Johns Hopkins has a vaccine mandate. And so if I want to keep teaching in person at Johns Hopkins, I have to either get vaccinated or distance and mask with an exemption, right? With a particular exemption that will be vetted. And I think that's totally within the rights of Johns Hopkins. And it's good from a public health perspective, because now we're actually addressing the good, right? So vaccination numbers going up from an institutional or population level, that can drive the R0 down, whereas my individual vaccination doesn't do much by itself. So addressing this at the collective level seems like the right thing to do anyway. And we're not talking about holding people down to get vaccinated. We're talking about conditionals, so.
Right, I think, I think I live in New York City, and we have a vaccine passport now, where you have to show, to get inside any restaurant, movie theater, you have to show this card at the door. And I don't support that. To me, that goes a little too far. And, I think it can hurt certain populations more than others. And we've never had it before. So it's really strange walking around the city now and seeing the sign. And even if, like, oh, you forgot your vaccination card, you can't go in, even if you left it at home, you can't go in. It's kind of strange.
So it's definitely not an easy case, right? There are ethicists debating whether, for exactly the sorts of reasons that you brought up, so unequal impact, right? So especially if something like a vaccine passport differentially impacts marginalized populations, that's a problem of justice. So that's a question that, if the answer is yes, is a strike against the policy. Now, if it also reduces the prevalence of the virus and that saves lives over the aggregate, that's in favor of the policy. And now we have a really hard weighting problem, right? But absolutely, like, it is not an obvious sort of answer. I think until there's evidence that there's really unfair, disparate impacts, I think that I'm okay with a lot of restrictions based on vaccines. So whether it's vaccine passport, whether you have to have a green on your app, right, a green light on your app, however we talk about it. What I think is important is that there's choice preserved, right? So the state is not saying that you are required to get a vaccine. They're saying that your access to certain goods depend on your getting a vaccine. And that might feel like splitting hairs to some people, but it's really different, right? Because giving you a conditional is not holding you down and violating your bodily integrity.
So the one thing I was thinking about this, I was standing outside of a restaurant the other night, and there's no other option besides showing this vaccine card. And I kept thinking, well, what if somebody chose not to get the vaccine because they have an underlying health condition? There are those people out there. Some, women are concerned about pregnancy, and they chose not to. There's no option to wear a mask even to get in these restaurants. And I was just, as someone who pays taxes in the city, I was like, I don't really like that. I mean, I don't know what the morally righteous thing is, but to me, it felt very, very restrictive without having any other kind of choice, I guess. I don't know.
Yeah, no, I hear what you're saying. The one thing that's really hard about restaurants is that you can't mask while you eat, right? So at the university, so at Johns Hopkins, our students, faculty, and staff can get an exemption, medical or religious. And the requirement then is just that their restrictions strengthened considerably, right? So before Delta, we thought we were going to be unmasked without de-densifying, et cetera. But if you had an exemption, you could not unmask, you could not eat together with other people. And so the idea here is you go back to, you don't have the right to kind of breathe around other people unrestricted. So even if you have the right not to get a vaccine, that doesn't entail the right for other people to have you breathe on them if you are more at risk of having the virus. So now restaurants get really hard, restaurants, bars, because this is not my classroom. This is not an airport. This is a place where you are going to put food in your mouth and to, talk in a loud environment, et cetera. So I think it's going to be hard to consider the conditional as, masking and distancing could be as good as vaccinating, when it's not going to work because you're constantly pulling your mask down, or once you sit at your table, it's off, et cetera. So yeah, there are going to be problem cases that won't show up on an airplane, for instance.
Right. Of course, the science now is sort of saying that while you're fully vaccinated, you're less likely to get infected. If you do get infected, especially with the Delta variant, you can't transmit as much, which leads to more questions because it's harder, right? It's just harder. These aren't black and white issues. And I understand when people are making policies, it's you kind of just go with one thing, but I'm like, well, if a fully vaccinated person gets infected, they can transmit. And with a high R naught, which is a reproductive number for anyone who doesn't know what that is, meaning like if I get infected, how many more people can I spread it to? You could do a lot of damage. But I appreciate that explaining that. It's just weird walking around the city and seeing these vaccinated only signs, because it's just it's a very strange time in history. I guess my final question to you, in general then, since vaccination is not a moral obligation, which you just explained, is personal choice, upholding somewhat personal choice, is that the ethical route to take, in your opinion?
So I do want to be careful and not focus too much on personal choice, because one of the responses I've gotten, after I first published this piece, I got asked to do a radio show in the UK. And so one of the responses I got was, oh, you Americans just love your autonomy and your choice, right? It was like, I must be like, full on libertarian, just like, oh, my choice is what matters no matter what. Like that could be the only explanation here. And what I want to point out is that this doesn't actually have much to do about like your ability to choose come what may, because as a person who's really invested in public health, I think public health gets to curtail our choices sometimes. Is that this choice has a form that most others don't, which is that allowing the vaccine requires that you give someone access to your body, right? That's what makes this one really different. So this is not the same as, oh gosh, I should have thought this out. Other good public health, this is not the same as carrying guns, right? So this is not the same as other like public health threats where the constant debate is, do you promote the public health or do you allow for individual autonomy? This isn't just about individual autonomy, it's about bodily integrity, right? That's what makes it so weird. I don't know if you've seen people who are at like anti-vaccine rallies holding up signs that say, my body, my choice. And this is a very, very strange turn of events, because some of these people, if you go and interview them as a journalist, they'll be very clear that they are not pro-life, which is where this slogan comes from, right? So it's like a little bit twisted to use that slogan in this context, especially if you're inconsistent. But what you could do is have a coherent view where at bottom, what's super important is that people get to decide who gets access to their body. And then it actually does have that relationship. Like the slogan's not a crazy one. It just got operationalized in this like not very nuanced, sometimes hypocritical way. But the basic idea that like I have unilateral authority over my body, yeah, that's kind of what I think.
I like that. And it's a great kind of summary of your explanation that you are able to give permission who has access to your body. And that's very relatable in the situation. Travis, thank you so much. It was very interesting. I look forward to sharing it with our viewers and I want to thank our subscribers and look forward to your comments. There's always some good comments. People are very heated on this issue, rightly so. So there's strong opinions, but I appreciate all the feedback. I think it's important to hear everybody's point of view on this. So thank you to all the subscribers, and hopefully you can get more people to subscribe if you haven't yet. And Travis, thank you. Enjoy your long weekend. And I appreciate you taking time out of your day on a Friday night to do this.
Yeah, no, thanks for having me. This is great. And comments experience, like this is what this is about, is better engagement, right?
Yes.
So, absolutely.
Yes, absolutely. Thank you so much.